Hello, welcome to my channel. Today we have another pediatrics question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 3-year-old boy is brought to his pediatrician because of a rapidly enlarging lump on the right side of his neck. His parents first noticed a small swelling yesterday evening, but by this morning it had become noticeably larger, tender, and the skin over it appeared red. About a week earlier, the child experienced several days of mild fever, runny nose, and cough that resolved without treatment. During that time, he had been visiting relatives, and several children at the gathering had similar cold like symptoms. He has no significant medical history, takes no daily medications, and is fully vaccinated. On examination, his temperature is 38.6, 101.5 Fahrenheit. There is a 5 centimeter enlarged lymph node along the right anterior neck that is warm, tender, firm, and difficult to move, with redness of the overlaying skin. Heart and lung examination is normal. The abdomen is soft without liver or spleen enlargement, and the remainder of the physical exam is unremarkable. Which of the following is the best next step in management? First, we need to think about the diagnosis. We have a young boy, and the boy is presenting with a rapidly enlarging lump on the right side, which is tender, warm, and firm and difficult to move with redness. And given his age, which is under 5 years old, and these symptoms, including a 5 centimeter enlarged lymph node, we can tell that the boy might have acute unilateral cervical lymphadenitis, and it can be caused due to different bacteria, including Staphylococcus aureus or Streptococcus pyogenes. And with that being said, let's go over the answer choices. A, itraconazole. Well, itraconazole can be used for a disease called histoplasmosis, and which is a fungal infection common along the Mississippi River in central United States. And the symptoms of this disease involve the lung, and you could have lymphadenopathy or lymphadenopathy plus hepatosplenomegaly, which is not something we are dealing with here. So A is not a good answer choice. B, observation with supportive care only. Well, this is not going to be helpful because uh, the enlarging lump is tender, so it's painful, and there is a risk for abscess formation. C, clindamycin. Well, clindamycin is a good empiric antibiotic that can address Staphylococcus aureus and Streptococcus pyogenes and some other anaerobe bacteria. So it can cover a lot of bacteria that might lead to acute unilateral lymphadenitis. So I would say C could potentially be the good answer choice. D, azithromycin. Well, azithromycin is used for cat scratch disease, which is caused by a bite or a scratch from a cat, and that could present with unilateral lymphadenitis as well. But we are not seeing that here. There is no mention of a cat. And also, azithromycin can be used for non-tuberculosis, mycobacterial lymphadenitis, but that is unilateral as well, but that is purple and it's not tender. So azithromycin is not a good answer choice. E, oseltamivir. Oseltamivir can be used for the the bilateral lymphadenitis caused by influenza disease. But the point is, with influenza disease, we have bilateral lymphadenitis, not unilateral, which is the case with this patient. So E is not a good answer choice. F, ceftinir. Ceftinir is also an antibiotic, but the problem is it does not cover as many basically bacteria as clindamycin. It only, I guess, covers Streptococcus pyogenes, and so it's not a good empiric antibiotic. And with that being said, the right answer choice is C. Thank you very much for watching, and don't forget to like and subscribe.